Going back inside, we're due to start our next session. We're very grateful to Dr. Al Hajeri, who will be introducing Her Excellency Dr. Omniyat Al Hajeri. Thank you very much. Please, can we ask everyone to come back inside? We're about to restart. We're running late. Thank you very much for coming back in. And thank you very much, Asil Al Hajeri from Abu Dhabi Public Health Center, for introducing our next speaker, Her Excellency Dr. Omniyat Al Hajeri.
Assalamu alaikum, welcome back again. Our next session will be about local guidelines, what's there and what's coming. This session will be presented by Her Excellency Dr. Omniyat Al Hajeri, the Executive Director of the Community Health Division at Abu Dhabi Public Health Center. Her Excellency is a specialist in the field of public health and leadership, also practicing consultant physician in the field of diabetes, endocrinology, and metabolic diseases. She studied medicine, worked and trained in Ireland for 12 years, and worked around 20 years at several Abu Dhabi hospitals. She also served previously as an assistant professor of internal medicine at the University of Medicine and Health Sciences. Dr. Omniyat is a board member of Abu Dhabi Sport Council and the Academy of Sheikha Fatima bint Mbarak Women's Sport. Please welcome with me Dr. Omniyat Al Hajeri.
Assalamu alaikum jami'an. And good afternoon, or still good morning, I guess, everybody. It's really difficult to talk after the amazing speakers that were there this morning. And I think I'll be boring, so you'll have to bear with me as much as you can. And I hope nobody have wasted his time calculating my age, knowing the years that I've studied and the years I've worked. So to start with, and this is a slide that I need to change very soon, I have no conflicts of interest. And I think I need to add to this list, because the more people that we work with, the more likely that we will have an impact, and that our impact will basically not be just in Abu Dhabi and in the UAE, but also reach beyond. I'm going to take a few moments to introduce you to the Abu Dhabi Public Health Center. I just want to know how many of the group here know the center. Can I have a raise of hands, please? Okay, that's great. I didn't waste the slide then. The center was born on the 23rd of April in the year 2019, just 6 months before COVID hit the world and UAE in particular. So a lot of people will probably not recognize it as a center working on chronic diseases, but a lot of the people that lived in UAE at that time will remember the center for a lot of the great efforts that happened for the COVID control. After COVID, we are re-merging again. I think the real risk now is basically how can we transfer a lot of the knowledge that we've had during COVID time, where we basically learned that there is nothing impossible and that everybody is able and everybody can do a lot. And when we really need, we can just bypass all excuses and transfer that into the non-communicable diseases. Why? Because it's the area of my passion? No, because it's actually the first killer of people here and almost in every other country that I'm aware of in the developed world. So what do? We work together with leaders like you on the ground, from the country, and from everywhere to ensure that people in Abu Dhabi have a very healthy and safe society. And we have a lot of initiatives that goes in there, His Excellency Dr. Ahmed today have mentioned a few of them, and I think emphasizing the role of data and the possibilities that data brings to a group of highly specialized, highly qualified scientists like you and clinicians is a great offering. We have millions of data points. We mind less than 1 to 2% of those. And we really need to work a lot on them. So here we are in Abu Dhabi. I always refer to it as the heart of UAE. And I'm not going to waste your time talking about the burden of obesity. This has been covered this morning in a much better way. And basically, I don't think any of us needs to know that if we deal with some of the exact opposite of what Dr. Arya was saying today. It's very interesting to have this slide here. I wish I just can delete it, but it's there actually. So weight loss does not always equate to what we really need to achieve. I keep learning every day that what we are basically targeting is better health outcomes. Realistically, though, we are still measured on KPIs that focus on numbers. So we have to find a bridge between what we need to report back on to sustain all our projects and be able to do all the great work that we are doing, and between the fact that we all know simply that, yeah, people can be obese and have no disease, and that we are really looking for health gain rather than just weight loss. So how do we work? We are part of a very dynamic, robust environment. There is full collaboration between local entities and the Ministry of Health. Some of our colleagues, I'm not sure if they are here today, but tomorrow there will be some colleagues from the Ministry of Health also. We work together as one unit. We have national committees, and then we also have our local committees that looks after fighting obesity, fighting childhood obesity, and the result of that is a multifaceted approach, multiple levels, but that basically covers all our needs. So it's not only policies and standards, we also have a strong system that looks after prevention and management initiatives. Dr. Ahmed today mentioned 20 of those. Hopefully, in the next time that we come to talk to you, one of my team will be talking to you about what we've achieved within a year in those 20 initiatives. On purpose, I didn't put the slide today. I may hide a few of them that we will not achieve, no. And surveillance. I'm an old believer into if you do not measure what you are doing, you cannot actually manage it properly. And as basic as that sounds, as important it actually is. So looking into the presentations today from Joanna and colleagues in the World Obesity Federation, we are part of the lucky countries that actually have standards of care, and we do have guidelines. And that goes to many years ago. I started with the federal level and other colleagues. So we have clinical practice recommendations for the management of obesity in the UAE since 2018. And it was actually developed by colleagues that are working in primary healthcare, which is, again, a very interesting entry point. We also have the standards for bariatric surgery that our colleagues in the Dubai Health Authority have published. And I'm taking you to the area where I have a little bit more expertise. So those are some of the things that we try to work on in Abu Dhabi as part of public health in general, as part of DOH, Department of Health, before we've actually separated into the Abu Dhabi Public Health Center. So we do have the HAD guidelines for the provision of bariatric surgery services. And that was the time where there was a lot of evidence coming to us that, yeah, it is a very effective intervention, it's not being covered appropriately, or sometimes it's actually being misused, and a lot of surgeries done unnecessarily for people that may benefit from other types of treatment, and some of them are age inappropriate. So the first step we did at that time was get to colleagues, Dr. Haddad, Sarah, Dr. Safwan, I don't know if he's here or not, but this is the group that we've worked with from day one. And that standard in 2012 have then also been followed by a standard for diagnosis management and data reporting of interventions for weight management and obesity in 2013. Now, the real question, and you'll see a lot of the guidelines, I'm going to take you through the updates of those guidelines also. The real question that I kept asking myself all this time is, why is this not working? Guidelines are there. Why are we not reaching people? Why are we not able to change any of the numbers? Why are we not even able to stabilize those numbers? And again, like we've tested all possible theories, so we tried all what we can in prevention. We've done a lot when it came to enabling, empowering people through campaigns, through Sahi program, where they get easy, direct label that tells them this is a healthier option for your health. A lot of programs like health promoting schools, yet we are still not there. This was an important review of the old available guidelines. And the important part in it that I'd like to highlight is that we've tried to move from only patient safety and having the papers there to actually having an audit arm that can actually go to those centers, basically measure what's happening there, review cases against existing cases already. You'll probably notice that this is 2018, and unfortunately, this standard doesn't have a sort of referred to pharmaceutical therapy. It was 2 words actually, I've checked them yesterday. And I was trying to think like, I authorized that. And fact is, how would any of the colleagues on the ground find it really useful? I have no list of medications, I have no indication for when can they use what or when can they actually refer somebody to it. So we went into a deep dive exercise where we were almost losing hope with the adults, and we just thought, okay, let's try the children. And what we wanted to do at that time was basically, let's get the standards in, but let's actually try this on the ground. So we've had 4 primary healthcare clinics trained to offer this service. We've linked the standard to our school health screening. So there was direct referrals from the schools for the kids that needs to be seen. And we've stratified the level of care into 2 different levels. And basically, we try to offer all the support that we can give to the parents, make sure that we have a multidisciplinary team, and make sure that we can actually refer to level 2 of care if needed, where those kids will have access to bariatric surgery, they'll have access to anything that is medically needed and warranted at that time. What happened after that? COVID decided to come. And basically, the 4 clinics stayed as 4 clinics, rather than grow up into more and more and more and just have it as a systematic approach. The hope was that we will be building our obesity register at that time, including childhood obesity register. And this is exactly what Dr. Ahmed was talking about today. So I'm not going to spend a lot of time on the update for the 2022. This is more, I'll call it rearrangement. We really wanted to make sure that groups and centers that call themselves centers of excellence are actually doing what they are supposed to do, have the multidisciplinary groups that they need, and have an access to an easy document that can actually allow them to build those services for the future as they need it. Where I find it really interesting is what's coming next. And I have to say that with the new leadership that we have within DOH and within ADPHC, I personally feel this is the best time that we can really drive things into execution mode. We've had a lot of documents. This is the first time that within less than 7 to 8 months, we actually translate those into actionable items, including the obesity register that His Excellency was talking about, the fact that I can now go and look specifically for segments of my population that are either at risk of being overweight or at risk of being obese, defined unfortunately till now by their body mass index, basically. But we did integrate the Edmonton scale also as part of the register, and we have a breakdown of our community as what stage they are in, basically. We yet have to move this into actionable interventions through knowing which of our population segments is going to have the highest yield, who do we need to intervene with first, how can we actually do this? So what's coming is very exciting, and not only at the level of Abu Dhabi, but it's so exciting also at the level of the whole UAE. We are finally working together almost at the stage of publishing the national standard for weight management and prevention of adulthood obesity. And I think our next step naturally has to be children and adolescents, basically. But in Abu Dhabi, we're also looking into testing a new model that hopefully will be announced before the end of this year. And it's not only having the standard or having the policy, but having a comprehensive approach that can actually allow people to use this medication as part of a comprehensive lifestyle intervention. For a very simple reason. We know that there will be a very rapid, hopefully, drop in their weights. What we really need is to ensure that they gain some healthy habits to help them maintain that long term. Otherwise, regain of weight is going to be our next challenge when we meet here to discuss. And I think there is a lot that can be done by this step once it's on the floor, because for the first time, we have the standards. We have also reimbursement linked to the standard. And I think that's where our major weakness was. So guidelines are there, but people are not covered for them. Or not all people that need them are covered for them. Or people have access to it when actually others need it more. So this is hopefully going to be a model where we can link everything, be able to connect the rules with the implementation on the ground, with the wearables of our patients in general, having their feedback, recording changes that they've made already in their lifestyle, and looking into the trends of their weight. I can't think of a more interesting paper and outcome that hopefully comes out of that. And again, like being the regulator, we are here to advocate, we are here to open doors, we are here to make sure that clinical leaders like you can make the difference, that they can actually motivate and implement. We are a very small number, basically. I can see Dr. Mariam here, Asila. Not sure if our colleagues from His Excellency the Chairman Office are here also. But if you count the total number that's working on obesity currently, Dr. Alamis is here. The total number of people working on obesity currently is probably less than 10 to 15 people. There is no way that this number is going to be able to change the direction and change the numbers and make sure that our patients are getting the care that they deserve. It's only when people like you on the ground decide to make the difference and decided to move forward with it that we will be able to implement. I've seen it before. When I first started my whole journey in public health, basically started with one conference that I was invited to. And I think it was, I don't want to mention the company name now, because that's going to be a conflict of interest. But basically, it was the European Diabetes Study Group meeting. And the first thing we've done when we've returned back there as a group of physicians was establishing the Abu Dhabi Diabetes Education Study Group, which died after that because each of us have a different direction. But we've changed lives. We've trained hundreds and hundreds of our colleagues in family practice. And this is what you can actually do. Start the movement, give the torch to the best player after you, and let them run with it. My area of passion is really in the antenatal and postnatal home visit standards, because that, for me, as public health, hits so many important angles, not only basically normal antenatal, postnatal care, not only the fact that we are finally making this possible in people's house, but also that in addition to assessing their needs, giving them the help that they need there from a multidisciplinary team based on very expert nurse practice, there is also the element of being able to see the person in his own environment, helping us to diagnose and know if there is any issues related to their mental wellness, to their mental health, to their needs at their home. This is the future where we need to be. We need to be with people where they are and where they need us the most. So with that, I close and I thank you. And I hope it wasn't as boring as I thought it will be. And what I'm really looking for is few of you, hopefully, next time, and whenever we are doing this conference next year, inshallah, coming here and sharing with us your experience in a project or a research or something that you have started based on today's discussion. Otherwise, all what we say here or do has no real added value. It's only in our ability to make the difference and make the change. Thank you, and I'd like to thank also Dr. Sarah, Haddad, Gerald, Wolf, for just allowing me to be here. I really appreciate this, and looking forward to talking to you next year, inshallah. Easy questions or no questions, please.
Thank you so much, Your Excellency, for the comprehensive and insightful talk. As we are running out of time, we will open the floor for one question only. I think there is a question.
I usually have that effect on the computers. They just go silent on me. First time I see it on humans also.
Well, thank you for a wonderful presentation. I find it very easy to have very strong ambitions about doing things, but everything gets stopped at the implementation stage. Can you tell us what challenges you've had for implementation and how we can energize people to help the implementation?
Thank you for the question. Honestly speaking, I've been in public health since 2012. And the fact is, at some stages of my career, I felt like a hamster. I seriously felt like I'm moving and moving in circles and nothing is happening. Well, at least nothing at the scale that I would envision and that I believe that our people here and our community deserve. So the fact is, we are only as good as our teams are. We are only as good as how much we can bring the best version of each of us into action. And I think there has been always the challenge of working in silos. And I have to admit, like I probably had that fault in some stage of my life. It's easier to just proceed with what you want, don't connect and start implementing. It's easier to work on something on your own. But the fact is that that's the easiest way of killing your plans. We need very structured plan. We need a proper communication plan. We need clear milestones. We need to be able to leverage all the strength and the soft power that we have on the outside. There are many of the initiatives that succeeded for us during this year. We didn't even fund or budget. There's a lot of our outreach activities that has been done based on collaboration. It takes a lot of focus and momentum, and sometimes, you know, sometimes you just see it's happening because your milestones are finally not facing the same hurdles that they were facing before. For example, the NutriGrade, the front of the package labeling that Dr. Ahmed mentioned today. We've been trying to work on that since the year, actually, the same year that I've entered public health. We were never able to get the support of the very senior leadership to take this active step. This year, we just have a great alignment. We have a very strong enabling chairman who is pushing very hard. We have supportive leadership within DOH, and we have very highly focused leadership like Dr. Ahmed, where for the first time he also gives us people, not only ask us to do things. So finally, you have the plan, you have the vision, you have the milestones, you have the enablers, you have the money, or you have people. I keep telling my team, and they probably will remember this, those are chances that comes only once in a lifetime. And if we lose them, it's very unlikely that they will happen again till at least 4 to 5 years. I hope I didn't take so much time trying to pass the message, but I strongly believe that open doors, keep good relationships, have faith, because at the end what we are doing is for the benefit of the people. And if we do it for the right intentions, things will align one time, one day. When we are feeling like the hamsters in the wheel, it's always helpful to talk to our colleagues that have been in that stage and moved through. And a lot of the times we stick together because we love working together. So I hope that this is an answer.
Thank you. I have faith in you.
Thank you.
Thank you so much again, Your Excellency. Dr. Sarah, the floor is yours again. Dr. Maryam, sorry.
Dr. Maryam is another long-term warrior.
Thank you, Sa'adat.